in this lesson, I'd like to discuss visual fields and optic pathways. So when we begin ourselves thinking about this, let's go over a quick review of some anatomy here. Here we have the posterior parts of the retina. Coming from there, we have our optic nerves. And then here we have our optic chiasm, which will go off into these optic tracts. Now, anything that you see, I have my medial visual fields, and then I have my lateral visual fields. Medial visual field is what is inside in the middle vision. They're kind of right in front of you. Lateral will be more off of your side. And anything that is lateral, when you see it, it actually strikes the medial side of your eye. So lateral visual fields is detected here by the medial retinal field. The medial visual fields strike the lateral retinal fields. And let me put dots here. Now, anything here, there are two distinctive pathways. For the pathway for the medial visual field or lateral retinal field is an unusual pathway. The lateral retinal field is an ipsilateral pathway, meaning that it follows on the same side of the nerve as it comes in. The medial visual field, or the medial retinal field, lateral visual field, is contralateral. So it crosses over at the optic chiasm. And understanding this teaches us a whole lot. Now, if we stop there, which most A&P classes would, but I want to go in and think about this a little bit more. Now, imagine, if you will, that I come here, a patient comes in, and they're going to describe some symptoms to you. Now, I'm going to show you what the damage is first and see what it is they would describe. I'm going to damage here the right optic nerve. Now, with this, if I damage the right optic nerve, it's pretty obvious that the medial visual field, as we traveled it from the lateral retinal field, that's destroyed on the right eye. So the lateral visual field is dead. So we can color that in, the lateral visual field. Because patients don't know retinal fields, they know their vision, they know that they can't see. Now, what else would there be? Okay, we'd be blind on this side too. You see why. We would have blindness in the entirety of this eye. This eye here would be okay. Now, let's remove this damage here. We can even draw back in our pathway. Now let's damage it. And we can damage it a wide variety of places, but let's damage it here. Let's damage it on the optic tract on the right side. Now the right optic tract, now look here, let's follow this visual field. Here we have, follow it out, my lateral visual field on my left eye is out. So lateral visual field on my left eye is out because that's where the information is coming. And then the lateral visual field in blue, let me come back and trace that again, would be out. So this is our medial visual field here on our right eye. So right eye would have this. So we would be having this unusual vision problem. So if you tested a patient, this would be what it would let you know they have. Now let's look at one more. Now I'll just say that this patient, for a variety of reasons, either has a tumor right here on the pituitary gland, and it's pushing and damaging here in the optic chiasm. but just there in the middle, because remember, the lateral retinal fields are inside here, and if I compress this and push on it, then I compress only the lateral visual fields on both eyes. So this patient would possess tunnel vision. And tunnel vision can be a symptom here of a pituitary tumor, or a lesion on the optic chiasm, or even an aneurysm in the circle of Willis, which you guys haven't learned yet in AMP 2, but the blood vessels around here, which you guys will learn later, can be an aneurysm that would cause, oops, sorry, I colored in the wrong side here. There we go. This would be tunnel vision. And so just understanding the optic pathways, you can do a whole lot. And it's kind of important to see how this works out, but it's a good way to test. Do you really understand the difference between the medial and lateral visual fields and the medial and lateral retinal fields and the tracks they take? Because this has important clinical significance in healthcare. And this concludes my video on optic pathways.